Hello, doctors. Let's talk about teaching stations. So, teaching stations are also really easy to pass because in these stations you are interacting either with a colleague, like a junior doctor, or a nursing student or a medical student. So, and they are very uh, cooperative. So, and like you can use medical jargons in the station, so you don't need to oversimplify things. So that's these are the things that make teaching station really easy. Okay, so I will be discussing the general approach of uh, managing any teaching station. So there are quite a few teaching stations that are coming these days, including EpiPen, urine dipstick, and subcutaneous needle injection, ECG, or any of the examinations like abdominal examination, or teaching pap smear, and inguinoscrotal examination. Okay, but I'm discussing just a general approach to cover all the stations. Okay, um, so and start with the teaching station. You can actually know that the station is a teaching station by reading the scenario outside the cubicle. So keep some questions in your mind for building rapport while you are outside the cubicle. Okay. All right. So first thing, all of us know that we need to introduce ourselves. So as in this station, we are talking to a colleague. So it is preferable to introduce yourself by your first name. Okay, and don't arrange the prefix of doctor with it. Like you can go, I am Dr. Aisha. Sorry, I'm Aisha, one of the junior doctors here. I'm an F2 here, and you must be nursing student Alex. Okay, so and then the simulator will say yes, doctor. Then you need to ask a few questions for building a repo, and that actually includes your data gathering in this station as well. Okay, so you need to ask a few questions. Think about it as like a general conversation with a colleague. So how are you? How is the rotation going? Are you learning new things? How is the environment, etc. Okay, and it covers your data gathering part as well. So the simulator does not waste your time usually, and when you ask him, "Are you learning new things?" he will say, "Yes, doctor, and today I'm here to learn about ECG or urine depth or anything." Okay, so appreciate him, tell him that that's great. I'm really glad that you have come to me, and I really appreciate that you are trying to learn new things. So then ask, is there anything in particular that you want to learn about? ECG, for example, or urine depth. So he might give you something like he might tell you, I need to know how to perform a urine depth study, or I need to know how to detect, how to calculate heart rate from the ECG, or how to tell if the patient is having an MI. Okay, so then it gives you like sort of a clue about how to about what to cover first in the station. Okay, and at the same time it also covers your ideas, concerns, and expectations part that you are asking about his expectations. All right. Okay, and also check, you need to check his understanding of the topic, his previous understanding of the topic. So always ask him, can you please tell me how much you already know about ECG, or how much you already know about urine depth. But rest assured that in this section they are going to tell you in the answer to this question, they are going to tell you that, doctor, I don't know anything about this, because they want you to demonstrate it to them in the exam. Okay, so now this part is very important, because you know some of the teaching stations like EpiPen or urine depth, they are very short, so you will be able to cover them in about 7 minutes. But some of the stations like ECG or some examination stations, they can take quite a long time, and you might not be able to cover all the things in 8 minute time. But please do remember that they are not looking for someone who can cover everything. They're looking for someone who can make the student understand. Okay, so if you are trying to cover everything and you are rushing, you will just appear like someone who is just trying to complete his stations without any concern for the students whether he is understanding or not. Okay, so please don't rush. So effective way of doing this is before like starting the teaching part, actually tell the student that before we start, Alex, let me tell you that if we are not able to cover everything today, we can arrange a session tomorrow as well. Okay, and if you need to repeat it, if you need to ask a question, or if you want me to repeat something, please let me know. Okay, so for me, I know that I speak really fast in real life as well. So when I was starting the station, I told the student that, Alex, I have a habit of speaking really fast. So if you feel like you're not getting something, or if you want me to repeat, you can stop me there and then. Okay. All right. So then you go into the proper teaching part, whether it is a urine dip or ECG, start teaching that. And meanwhile, for example, if you are doing urine dipstick station, so tell him that we need to take this strip and we need to dip it into the urine for about 3 to 4 seconds, and then we need to take it out and place it horizontally on a dry surface and wait for it to dry for 90 seconds, and then compare it with this graph here. So you can stop and ask him, am I clear so far? And then ask him if he could repeat the process for you. Okay, he might tell you that he might tell you, the doctor, I cannot repeat, I'm trying to take it all in, and these are like really new informations. So when he tells you this, just stop there and tell him that it's completely all right, Alex. I took my time when I was studying these things for the first time. No need to worry, and I will repeat it for you. Okay. All right. And doctors, please keep in mind that in any other station, teaching stations also have like three parts: uh, data gathering and IPS, and the management part. So the IPS, data gathering, is usually covered when you ask him, when you confirm his name and ask him a few questions about the rotation stuff, and asking him what does he need to know in particular, and how much he already know about this station, about this topic. Okay, but and you need to provide the management as well. So for example, you are doing the urine depth station. uh, Tell the patient that there are some things that are never usually present in urine, and that include leukocytes, that is white blood cell, and nitrites. So when these things are positive in the urine depth, what we do, we inform our seniors and we send this urine to the laboratory for culture. Okay, because we suspect that the patient might have UTI. All right. So what we do, we send the urine sample to the lab and we inform our seniors, because they might start the patient on antibiotics. Okay. So there you have provided the management. If you don't provide the management teaching station and you teach the students everything and do wonderful IPS, you will still get 8 marks, because the 4 marks of the management will be deducted. So for every station, just find a point where you can like give really good management in few lines, and you will get 4 out of 4 in the management section. Okay, so at the end of the station, tell him that, Alex, I will give you some study material and some links as well, so that you can study this topic at home. And then tell him that if you are struggling with any topic in future, just let me know. And that's it.